Rondebosch Medical Center is the new kid on the block. It is a full 24-hour hospital situated in Klipfontein Road. The Rondebosch Medical Center has a superb location in that it's positioned right opposite Red Cross Hospital.
We have worked hard to produce a facility that compares with any worldwide standard. We've gone for equipment that you will find in most modern hospitals throughout the world.
It has a comprehensive series of facilities, starting with an emergency unit on the ground floor.
By virtue of this being a fully functional, fully fledged emergency unit, we provide that service 24 hours a day. We equipped from that standpoint to deal from anything that's as minor as flu or chest infection, all the way through to active resuscitation. The other added benefit within the hospital itself is that we do have a fully functional ICU as well. So as such, we're able to admit a lot of our ICU candidate patients up to the hospital as well.
It's a general ICU, meaning that we'll take both medical and surgical patients. Patient that come from trauma or patient that's coming from theatre. The equipment is all state of the art, brand new, most latest one that you can get in the market.
The maternity unit, which comprises the labour ward, that's the delivery area, and the postnatal and antenatal ward, as well as the neonatal ICU.
We are equipped to deal with any sick baby. We set up for 2 neonates, premature, and we probably start from about 27 weeks on, or any sick baby that comes from labour ward or theatre.
Every hospital must have a neonatal ICU, but not every hospital has the unit managed by a qualified neonatologist.
Having a neonatologist on board is a plus, because if you look at all the hospitals around here, there's not a single neonatologist.
We've gone to a lot of trouble to make the pediatric unit very child-friendly. So if you come in, the child will feel very comfortable, because the first picture that greets him is Ben 10.
We've geared up the facility here so that it's available to treat all medical emergencies in children. We cover all pediatric referrals to this hospital 24 hours a day, 365 days a year, ensuring that when children get sick, that they get seen to immediately. Making sure the child is comfortable, making sure that the child is looked after well, that there's a play area here in the unit so that children can play as they're getting better.
A playroom, and that is for the children and for the parents. And the parents also spend a great deal of time in the playroom.
We're not only looking at offering an emergency care service for sick children, we're also looking at having added facilities to ensure that wellness in children is looked after, and that's something new in pediatrics. It's a really new concept. In other words, making sure not only that sick children are made better, but that well children's health is optimized.
Morton and Partners run the X-ray department, and their CT scan is at the moment the only wide ball CT scan within the Western Cape. And this was established especially for GVI Oncology, which is one of the largest, if not the largest, private oncology firm in the Western Cape, and Rondebosch Medical Center will be the headquarters. Summit Psychiatry is a private psychiatry unit which was established at Rondebosch.
We have here both beds available for mental health facilities as well as addiction treatment. So we treat both mental or psychiatric disorders as well as those affected with substance abuse disorders. What makes this different is that we've created a home away from home. So the comfort of home is brought into a facility, and so that we are able to provide comfort, reassurance, but also sort of healing, to get them out of a stressful environment that they find themselves in. Because it's situated within a general hospital, we have a kind of a cross-service between the medical fraternity and ourselves. So in other words, we're able to treat comorbid conditions.
Beautiful, spacious operating theatres, We provide the first-class equipment for whichever specialty is utilizing our theatre facilities.
Digitalized inputs are sent to all the consulting rooms, all the wards. In theatres, the images are on touchscreen monitors, which allow for easy access and for enlarging the images for clearer vision. The theatres are all major theatres, and 2 of the theatres are laminar flow theatres, which is capable of handling major surgical procedures such as the hip and knee joint replacement surgery.
What makes a hospital attractive is the level of service that is rendered. And we are aiming to render a first-class service. That is what we aim for, that's what we hope for, that is what we work towards. And I'm sure that is the vision of each and every practitioner who provides a service at this hospital.